good morning, and good morning, or good afternoon, or good night. I don't know when you're watching this video, but let me make sure my volume up. But I know you're watching it. It's morning for me right now. First of all, I want to thank you for watching, taking the time to watch, and I want you to read my shirt. I'm just out here trusting God. This journey has not been easy, but it's been rewarding. Um, Whatever feelings you're having right now, I just want you to know that your feelings are valid and you have a reason to feel the way you feel, okay? With that being said, before we get started today with our lesson, with our little talk, um, I want you to go grab a pen and a piece of paper, or if you have a journal, or if you have a little notebook that you just been taking all your birth notes in, I want you to go get it. Okay? So I'm gonna pause while you go get it, and I'm gonna drink some of my hot cocoa. Okay, I hope you have a pen and a notebook. Yeah, we're gonna get down to it. Some of you may know and some of you might not know, but I do have an auntie who is a breast cancer survivor and currently battling breast cancer again. But my cup is for her. Also, October is Breast Cancer Awareness Month as well as Domestic Violence Awareness. So, a moment of silence for everybody that's dealing with this and have dealt with it and anything else. Okay. All right. And you know me, so you know I love my coffee and hot cocoa, right? All right, so if I look to the side, it's always because I want to be very intentional when I come on here talking to you, educating you, informing you. So I have notes, and let's get started. So a couple of videos ago, we talked about just a questionnaire about how what you know and what you don't know. Hopefully, if you watch that video, then we have spoken with each other and you're a little more informed. Today, I want to discuss your birth preference. So, what do you prefer to happen at your birthing experience? So, what I'm going to do is ask some questions and I want you to go ahead and answer it. So, just like I said, make sure you got your pen and paper. And then when we schedule our next meeting, I want to go over this with you. So I want to make sure that I'm answering your questions, that I know what your birth preference are, because this is going to help with your birth plan if you don't already have it written. If you already have it written, fine. If you need to add to it, but if you do not have it written, this will help with your birth plan. Um, Again, you may already have a clear picture of what you want during your birth, or you may be open to many options. Either way, identifying your preference ahead of time will help you make decisions and communicate with your birth team. So we're just going to use this as starting points. Again, your birth team is yourself, the baby, your spouse, your partner, and your support system, which is me, your doula, and whoever else going to be there to support you. And then if you're going to the hospital staff. Let me pull my little headband down. Child, left my wig in the car and it's raining and cold. And I ain't want to go back out there. So I'm like, throw this little headband on and they going to get me the plain natural dope doula today. Okay? Anyway, so if you circle one, well, not circle one, sorry. If you write one, that means you want to avoid it all at all costs. Um, if you put a two beside the question that I asked, that means you have no preference. And then three, you prefer. So, example, labor at home for as long as possible. One, two, or three. If you want to write the questions down, you can. I will go slow so you can, just write the question down so you'll know what it is. So this is just the environment. How do you want your birthing experience to be? What environment do you want to be in? And we are starting. Labor at home for as long as possible. One, you want to avoid it. You just want to go straight to the hospital because you trust them. You believe they're going to make the right decisions for you, get you out of their house, get you to the hospital. That's one. Two, It don't matter. I can stay home. I can go to the hospital. It don't matter to me. Whatever. Just go with the flow, right? And then 3, yes, let me stay at home long as possible. So when we get to the hospital, it's time to get baby out. Calm and peaceful space. So 1, you want to avoid a calm and peaceful space. You want it chaotic. You want loud music. What do you want your space to look like? So 1, 2, or 3. Company of family and friends of my choice. You want to avoid company. You just want it to be your doula, your partner, your other support person. Who do you want with you during the early stages of your labor? 1, 2, or 3. Minimal distractions and interruptions. So if you're the type of person who zone out, like get in your zone and just want to stay in your zone, you don't want us bothering you, including me, and I respect that. So if you zone out and want to be in your zone and don't want to be interrupted, just let me know, because one thing I don't want to happen is you're in your zone, you're in tune with your body, and then I come rub your back or I come say something to you and it throws you off. I don't want that to happen. So I need to know if you're that type of person that kind of zone out and what that looked like for you. So if I see it, I know what it is and I can respect your time. All right. So that was labor at home, long as possible, calm and peaceful space, company of family and friends of your choice, and minimum distractions and interruptions. That's your environment. So we're going to go down to interventions. Again, it's 1, 2, or 3. Continuous fetal monitoring. We talked about that in a couple of videos before this. That's just when they hook you up to the monitoring machines. With my own personal experience, those machines are not reliable and they can let you down. When you first get to the hospital, of course, they will put you on it just to see what your contractions are doing and to monitor the baby. You don't have to get on it. You can actually ask them for a fetal Doppler, where they just come and listen to the baby heartbeat. The same thing that they use at the doctor's office. Every week that you go, or every 2 weeks, or however often you go and they listen to baby heartbeat. So you don't have to be hooked up to the continuous fetal monitoring stuck to the bed, okay? So 1, 2, or 3. Intermittent and or wireless monitoring. So would you prefer them just coming in every now and then, checking it without hooking you up, is what that is. Freedom to move freely at all times, meaning you're not going to be stuck in that bed. 1, 2, or 3. 1, you want to avoid moving around. You just want to lay in the bed. Or 2, that you can lay in bed or get up, it don't matter to you. Or 3, you would prefer to be able to move, walk, do whatever you need to do. Medicine to start labor induction. That look, because y'all already know how I feel about it. Okay? But it's your choice. This is your birthing experience. I can only advocate and let you know the right things that I think you should do based on evidence-based information. So if you want baby out and you want to get them Pitocin or stick Cervidil up your cootie cat vagina, then that's your choice, baby. This is your body. I am here to support you in what you want to do. Medicine to speed up labor. Frequent vaginal exam. So you want them just playing all in your cootie cat? Your spouse can do that. And I know he do it well because you're pregnant. Okay? So I don't think you need any stranger's hand just continuously checking you. No. We'll all know when baby is ready to come out. Breaking your water. Do you want them to break your water? IV access. That just means you're not hooked up to the IV pole fluids. You just have the access there. Epidural. Narcotics. Episiotomy. That's when they can cut you from your tutti to your fruity. Vacuum or forceps. Vacuum is when they put it on the baby head and suck them out like it says a vacuum cleaner. Forceps look like the salad spoons. They put it in you and pull baby out. Cesarean. All right, so those was just interventions. What interventions do you want? What interventions do you not want at all? Like, no, I don't want it. I want to avoid it at all costs. Policies is our next section we're going to go over. Give choices and explanations. So, do you want them just coming in your room and start doing stuff? Or do you want them to come in your room? Hi, my name is Shalise. I'm here to go over your discharge paperwork with you. Hi, my name is Shalise. I'm on here just to check you, see how baby is doing. And I mean, what I mean by how baby is doing, I want to check baby heart rate. I want to see, are you comfortable, and see if baby have moved down to the birth canal. I am coming in your room, letting you know what I'm going to do and explain what I'm going to do. Because them coming in there just saying, "Yeah, I want to check on you and baby." What that mean? That can mean anything. And next thing you know, your legs spread open and fingers up your stuff. Okay. And with that being said, as your advocate and as your doula, you will get respect, and that's just a level of respect to me. When they come in your room, that is your space. So when they come in here, they need to introduce themselves, and they also need to explain what they're going to be doing. Don't just come in here and start doing stuff. No, ask permission. This is your body. They need permission to do any and everything. Okay. 1, 2, or 3. Access to shower or tub. So if you want to be able to go into the shower, sit in there, just let the water run. 1, 2, or 3. How do you feel about that? Is that something you think you want to do? Freedom to eat and drink. Do you want to be able to eat and drink? Wear my own clothes. Do you want to wear your own gown? Do you want to wear just a sports bra? Or do you want to just be in a hospital gown? Feel like a patient, because you're not a patient. Definition of patient is someone in the hospital setting getting treatment because they're ill. You're not ill. You're not a patient. You're there to birth your baby. Okay. Okay. Choose my position for giving birth. So you already know, if you're going to the hospital, they want you flat on your back, legs open like a butterfly, pull them back to your chest and push. Okay? You know that's just standard. That's just what they want you to do. But if you want to be on your hands and knees, if you want to be on your side, if you want to be standing up, if you want to ask them if they have a birthing stool that you can sit on, if you want to sit on the toilet because that gravity pulls down, whatever you want to birth your baby, you have that right. And if you want to execute that right, just let it be known. 1, 2, or 3. Push without coaching. So you want to be able to push when you feel like you need to push, versus them telling you, "Okay, see baby head, hold your breath, count to 10, let's go." And then you're pushing while holding your breath, and they're counting to 10, and people holding your legs, and all right, stop. All right, do it again. 1, 2. Do you want all that dramatic, or do you want to be able to push because you feel the urge to push, or you feel like, okay, I need to push? Your body know how to birth the baby. Okay. Extra people / staff present for birth. So do you want anybody there outside of me and your spouse or your partner? Even with that being said, the hospital staff, sometimes they have student trainings, students that's like doing clinicals, or students that's in the field trying to get all their credits and whatever. If you don't want those students in there while you giving birth, make it known. Okay. I just want people in here that's going to be attending to me and my baby when he or she get here, and that is okay. We don't want extra people just standing around in your space. We don't need them holding space for you when they just learning what to do. So if you want just people in there that's really going to be hands-on, make sure you make that be known. Okay? And the last section we're going to go to is at birth / newborn care. So this is once baby get to Earthside, once baby get here, what do you want that to look like? Immediate skin to skin. So when baby come out, do you want them immediately lay baby on you? Yes, you do. delay cord clamping. If you're in a hospital setting, they, because they're so rush, get it done, in and out type. Sometimes they, let's say 30 seconds, they'll wait 30 seconds. But if you want, you can, um, you can let them know you want delayed cord clamping at least a minute, and it's not true that the blood go back to the placenta. If you've seen that viral video of a dumb nurse saying that it goes back to the placenta, like what? Okay. Medicine to deliver placenta slash control bleeding. Most times when they're pulling, sorry, that's a client. Okay, girl. Okay, girl. Medicine to deliver your placenta slash control the bleeding. I say slash control bleeding because once they deliver your placenta, well, for one, if your placenta is a little stuck, like because naturally it is still attached to you, right? You have to birth that like you birth your baby, so it just needs time to release itself. However, in a hospital setting, they don't give you that time to allow your placenta to release itself. They yank on it. They push on your stomach, and most times you're so caught up holding baby, you're not even noticing that they're forcing your placenta out. And with that being said, when they do that and tugging and pull it out, it can cause bleeding, and then they give you medicine. They stick it up your rectum to stop or control the bleeding. So if you don't want any of that, just make sure you let it be known. Eye antibiotics, that's the erythromycin that they put on the baby eyes. The only time that you baby should have that is, study says, if the mom have gonorrhea or chlamydia or any type of STI, you should use that to protect the baby eyes. However, if mom is fine, mom have no STIs, STDs, nothing, then there's no reason to put that cream on your baby eyes. So just make sure you let that be known that you don't want it. Like, you don't have to have it. It's not mandatory. And you just make sure you let it be known. Also, vitamin K injection. If you want, you can ask your OB for the medicine because they have it as well, where it's more organic versus the brand that the hospital have. So if you would like for your doctor office to provide the vitamin K injection for your baby, just make sure you let that be known so they can get it to you, because it is a prescription. Once you get to the hospital, you're going to have to give it to the nurses so they can take it down to the pharmacy to make sure it's legit and everything. But just make sure you ask your OB for that. It's just like folate and folic. It's kind of like folic is the off-brand mixed with everything else, whereas folate is more natural. Same thing with the vitamin K injection. The doctor's office can give you one that's more natural versus what the hospital will give you, that they use for everybody. Hepatitis B vaccine, if you're getting your baby vaccinated, that is a vaccine that they give at birth. Also, with all of these, most time they're doing it like right away. If you want to wait, like, tell them don't disturb your baby. Tell them to wait. It don't have to be done right away. The hospital is just set up to be rush, rush, rush. So you don't have to do it right away, okay? You can tell them, no, I don't want my baby disturbed until at least after the bonding time, because they'll give you an hour to hold him or her chest to chest. So like, don't touch my, like, I don't want nothing done to my baby. It at least for that first hour. And then if you choose to have any of these shots, vaccines, injections, antibiotics, anything, then you can do it after your 1 hour skin to skin. Circumcision, if you're going to get your baby boy circumcised. Exclusive breastfeeding. This is a tough one right here, because what happens is in a hospital, they'll try to offer you formula even though they know you want to breastfeed. Breastfeeding can be challenging, but you can do it, okay? So you're going to feel like you want to give up. You're going to feel like you're not getting enough milk. You're going to feel like this ain't for me. Don't believe what your brain is telling you, okay? Because it is for you. Your breast milk is the best milk for your baby. Even though it might not even seem like a lot, your baby's stomach ain't but so big anyway. So that colostrum that they get, which is your first milk, that is enough. Even though we feel like they need a whole cup of milk, a whole bottle of milk, no, that little bit that they get and then go back to sleep is enough. Okay, so don't get discouraged. Delay baby bath for how long? How long do you want to delay the baby bath? Again, the vernix that's on the baby it has protected your baby's skin for the whole 9 months baby been inside of you. So why is there a need to hurry up and wash it off? No, let it continue to sit on baby skin and nourish the skin. Continue to protect the baby skin. Okay, so don't be in a rush to just wash it off because it looks nasty. Come on. No, leave it on baby skin, okay? And then the skin will be flawless like the doula. Just playing, just playing. Rooming in, that just basically means you want your baby staying in the room with you at all times. Most hospitals don't even have a nursery no more. The nursery is closed. Like, only nursery they have is for the sick babies that go to NICU. Most of them do not have a nursery anymore. So that's that for today. I'm at my 20 minutes, so I don't want to, go over. Again, these are just your birth preference. Any other things that you think of course, add it to the list. If I went too fast, just hit pause because you're watching this at your own time. And then I look forward to talking to you. As always, I love you. I'm your dope doula, Lisa. Excuse me. And last but not least, if we do not have an appointment, you know what to do. So after every video, I'm going to be saying, we don't have an appointment. Make sure you get scheduled for your appointment, okay? Reach out to me and schedule your next appointment. So your homework for today, assignment is make sure you answer these questions so I know what your birth preference are. Have a good day. Bye.